If you're out in the field trying to get vascular access, it can be extremely challenging. Often your patients are cold, peripherally vasoconstricted, and they may have traumatic injuries causing exsanguination. So in these situations, ultrasound can be extremely helpful. Of course, the other alternative is intraosseous access. So some things apply when you're doing vascular access. Firstly, make sure that you have your orientation and your positioning good. You may be on the floor when you're trying to do this, but make sure you can clearly see your ultrasound machine. Where you're going to do the access is in front of you. You have gel on your probe and you've got your area prepped, ready to go. Vascular access can be fiddly. You don't want to be moving around trying to find things after you've started. Secondly, you want to make sure that with your ultrasound, you select a vascular access preset. So for this, we'll press preset and press vascular access. This vascular access preset will reduce the depth and increase the frequency, making sure you've got very good resolution to see your needle tip. There are two main approaches for vascular access. The first one is out of plane, where first and foremost, you have an out of plane view of that vessel. That means your vessel looks like a circle. You can track that vessel through the skin, through its course, up and down to make sure it's straight. The second way of doing vascular access is to then turn the probe 90 degrees clockwise, and then you can get the image of the vessel in its whole long axis. There are pros and cons to both methods, so it's worth practicing them both. Out of plane is probably a slightly easier approach to learn first, but you don't really get to see your needle tip through the entire course of its track. Whereas the in-plane view is probably better to see your needle going all the way through into the vein. However, it is a little bit more fiddly and takes a little bit more practice. Okay, so starting with out of plane approach, I've got my target vessel here very clearly. It's in the middle of my screen, and I've orientated myself so that if I slide the probe to the left, the image will move to the left. If I slide the probe to the right, the image will move to the right. This is very important with vascular access because I need to know that if I move my needle to the left-hand side in the patient, it's going to go to the left-hand side of the screen. So it seems slightly pedantic, but it means that you know where your needle is going to go. Secondly, you want to make sure you can see how deep your blood vessel is in the patient. We have on the right-hand side of the screen some graduations which have numbers on them. These are in centimeters, and so I can see that my vessel is about 1 centimeter inside the patient. So I'm going to go about 1 centimeter away from my probe. I'm going to go at a 45-degree angle and then puncture through the skin. I'm then going to keep my probe where it is, but fan towards my needle, like so, until I see my needle tip. So there I can see my needle, and I'm going to gradually follow it down as I advance until I see my needle go into the vessel. And there we go. We can see the needle right in the middle of the vessel. At this point, I will level out, making sure my needle tip is still in the vessel, and then I can advance my catheter. And there I have good vascular access for this patient. The next approach is the in-plane view. So I would normally find my vessel out of plane and then rotate by 90 degrees. So now I have my probe with a very good view of my vessel in plane. I'm going to take my needle and just proximal at the middle point of this probe, which has a marker in the middle of it, I'm going to puncture the skin. I'm then going to make sure I'm nice and shallow, and then, as you can see on the screen, I'm following my needle all the way through its course until I puncture that vessel. I'm then going to flatten out and advance my catheter. And there we go. Often you need a slightly longer catheter to do this approach because the blood vessel is a little bit deeper in the patient. However, we can very clearly see there that the catheter is sat inside the vessel and is ready to give any drugs or fluids. So the butterfly also has a mode called biplane, and this combines the two procedures that we've just talked about. So we can go to Actions, which is the bottom right button, and press biplane. And now with biplane, you have your out of plane view on the bottom and your in plane view on the top. Now I'm just going to slightly reduce the depth just so that my area is filling the field of view. Okay, so now for this, I have the best of both worlds. So I have an out of plane where I can make sure my vessel is centered, and I also have the in plane view so I can track my needle the whole way down. So now I'm going to insert the needle just proximal to the probe. Then I'm going to see on my top image, on my in-plane image, I'm going to see my needle coming all the way in. And as I get into my field of view, I can track the needle and make sure it's in the center of the vessel, as so. And then once I'm in the vessel, I can once again deploy my catheter and make sure it's in the right spot. As with anything doing vascular access, you're also making sure you look for flashback, and ultrasound guided vascular access is no different. You will still get flashback, but you can confirm that your catheter is in the right spot.